Hello and welcome. Today, we're diving into rivastigmine. It's a medication that has become a really crucial tool in our toolkit for managing some of the most challenging symptoms of dementia. It's a question that so many people, families, caregivers, doctors, are grappling with every single day. And while we're all pushing for a cure, the reality is we also need ways to manage the symptoms right now and improve quality of life. And that is exactly where a medication like rivastigmine enters the picture. All right, so here's our game plan. We're going to start with what this medication is for, then get into the science of how it boosts brain signals. We'll cover the practical stuff, how you take it, then talk about side effects, what to do in an emergency, and finally, we'll wrap up with the big picture. Okay, let's get right to it. First things first, what exactly is rivastigmine, and who is it really for? So rivastigmine, which you might have heard of by its brand name, Exelon, is part of a class of drugs called cholinesterase inhibitors. Yeah, I know, it's a bit of a mouthful, but that name actually gives us a huge clue about how it works, which we'll break down in just a sec. Now, this is really important. This medication isn't for every type of dementia. Its use is actually very specific. It's prescribed to treat mild to moderate dementia that comes with either Alzheimer's disease or Parkinson's disease. The whole goal is to help manage the cognitive symptoms that these conditions bring on. So how in the world does this medication actually help improve how the brain works? Well, it all comes down to boosting a very specific signal inside the brain. To really get how rivastigmine works, we first have to talk about something called acetylcholine. Just think of it like a super important chemical messenger in your brain. Its job is to carry signals between your nerve cells, and it plays a huge role in things like memory, learning, and staying focused. Okay, so here's the play-by-play. Normally, after acetylcholine delivers its message, these natural enzymes in the brain come in and clean it up. They break it down. But in diseases like Alzheimer's, you've got less of this messenger to begin with. So rivastigmine comes in and basically acts like a bodyguard. It inhibits or blocks those enzymes, pretty much telling them to stand down. The result, more acetylcholine gets to hang around in the brain, which can help make that signaling between brain cells stronger and clearer. All right, we've talked about the why and the how. Now let's get into the what, the really practical details of how this medication is actually taken. The great thing here is that there's flexibility. Rivastigmine actually comes in 3 different forms, which is awesome for suiting different patient needs. You've got a liquid oral solution, the standard capsules, and a transdermal patch that you just apply to the skin. Now, for the oral versions, the liquid or the capsules, a doctor will almost always start with a really low dose. We're talking just 1.5 milligrams twice a day. This is so important. The dose is then bumped up super slowly and carefully over weeks, and it's all based on how well the patient is tolerating it. And, this choice between the pills and the patch, it's a really big deal. The oral forms, they can be kind of tough on the stomach for some people, but the patch is a total game changer for a lot of folks. It delivers the medication steadily through the skin, which means you often see way fewer of those tough GI side effects. Plus, let's be real. If someone is struggling with memory, remembering to put on 1 patch a day is a whole lot easier than trying to remember a pill twice a day. It just makes things so much more manageable. Okay, this next section is incredibly important. As with any medication, you absolutely have to know what to watch for when it comes to side effects and other warnings. So, the most common side effects are mostly related to the stomach. We're talking about nausea, vomiting, and diarrhea. Those are the ones you hear about most often, along with a possible loss of appetite. And again, this is exactly why starting on that super low dose is so critical, and it's also why the patch is often the way to go. And here's a really crucial note for a specific group. The safety of using rivastigmine during pregnancy, it just hasn't been established. So it's one of those medications that should only be used if a doctor decides that the potential benefits clearly, without a doubt, outweigh the potential risks to the fetus. This leads us to a really critical topic. What happens if there's an overdose, and what's the emergency plan? This is information every single caregiver needs to know. The signs of an overdose are pretty much the drug's normal effects, but taken to an extreme. We're not just talking about bad nausea and vomiting, but also much more serious signs, like a very slow heart rate, muscle weakness, and in the most severe cases, things like convulsions or trouble breathing. If you see these signs, it's a medical emergency. The medical response here is very clear. First, you stop the medication immediately. Second, supportive care kicks in, things like IV fluids to prevent dehydration. And third, another medication called atropine can be used to counteract some of the most serious effects, like that dangerously slow heart rate. Now, just as important is what not to do. The medication scopolamine is a huge no-go. It should not be used in this situation because it has its own powerful effects on the central nervous system that could actually make everything much, much worse.
Okay, let's pull all of this together. What's the big picture here? What's the main thing to take away from all this? Well, it really comes down to seeing this medication for what it is. A very helpful tool, but not a cure.
To keep expectations realistic, it's just so vital for patients and their families to get this key point. Rivastigmine is here to manage symptoms. It does not stop, and it does not reverse the underlying disease process of Alzheimer's or Parkinson's. And that right there is its true value. It's a cornerstone for managing the symptoms. By boosting those brain signals, it can make a meaningful difference in cognitive function, attention, and memory. And that, in turn, can seriously improve a person's quality of life, even if it's just for a while. It's really all about making today better. So I'll leave you with this to think about. Rivastigmine works by tackling a symptom, that lack of a key messenger in the brain. As we keep searching for a true cure, what does this focus on managing brain chemistry today teach us about the really complex pathways we might need to target to actually stop the disease itself tomorrow? Thanks for tuning in.